Hello everyone, this is Dr. Anam Zahir and I am here on my YouTube channel, Homeopathy Heals, on a short notice. I doubt if we have more audience here because of short notice, and it's my first YouTube live. So I was studying Aconite, so I thought of sharing the inputs, some of the literature and references. So as we all know that Aconite is a drug of tension. There is huge turmoil which is not just on mental level of fear, anxiety, restlessness, but on emotional level. Patient is extremely oversensitive. The pulse is on physical level, pulse is hard, pound. Very good morning, Dr. Ajay Mehra. So today I'll be talking about cough of Aconite and I'll be comparing it with other drugs. As we all know, it's the season of viral conditions and at times cough become very difficult to treat. So here I start Aconite with Spongia and Causticum. So Aconite forms a very important trio of affections of cough, where cough is dry and it comes on exposure to dry cold winds. So cough is of croupy nature and very suffocating. Sometimes patient also suffers with a sudden cough with the pain in ears. The child will grasp the throat and he tries to cough. You'll feel the pain of a cough of an aconite. If here I compare aconite cough with Heparself and Sambucus, the cough is aggravated in the morning and end on uncovering in case of Heparself. Never ever forget this. Even in Heparself, the cough is due to dry cold winds, but it is aggravated in the morning. Mother will say, as soon as he get up in the morning, he starts coughing. As soon as he remove the blanket, he starts coughing. The remedy is Heparself. There is a regular rattling of mucus in cases of Entemtard. When it comes to Entemtard, if you auscultate the lungs, the chest field, lung field is full of mucus. There is rattling. Even with your bare ear, you can listen the khad sound patient is giving. When you listen this sound of cough, think of Entemtard. The cough is so much that child can turn blue in case of Entemtard. Another remedy where there is a spasm of glottis. Coughing and there is a spasm. Patient is not able to breathe in Entemtard. And you will listen the sound of wheezing. The trouble is more and worse in the midnight and while lying the head low. So patient, if you ask a patient to keep a high pillow and sleep, patient will be able to sleep. But as soon as if he removes the pillow, he'll start the coughing again. The patient in aconite, in Entemtard, will be able to inspire better and the expiration will be very much difficult. So patient will cough when he expire, not inspire. We have comparative Materia Medica drugs given in Allen keynote as well. So coming up, if I talk about pleurisy or pneumonia of aconite. So aconite can be thought of in a very first stage. Always think of aconite in very first stage of any disease, be it fever, be it cough, be it pleurisy, any. And the onset should be sudden. For example, a mother came and she said, my child is having cold. And next day she bought the kid with pneumonia, pleurisy. How fast the disease has traveled. So never ever give a slow acting remedy in a fast disease progressed cases. Always match the pace of disease with the pace of a remedy. Always. You won't fail. So in aconite there is sharp stitching pain will be felt, and patient has chills, patient has fever, especially when we have a case of a checked perspiration. Have you seen a patient or a kid coming from school and they are full on sweat coming with the school bus and they remove their clothes immediately, and what happened? They have fever, they have cough. Even their mother's coming and saying, I asked him not to drink cold water as soon as you're coming from school, or do not remove your clothes, and see he's having cough, he's having fever, or he's having pneumonia. First stage, think of aconite, because there is suddenness not only in the disease symptom but in the cause as well. Okay, so right here we also speak about aconite in pneumonia in the first stage, where the affection of lungs is very common. Imagine a common cold has turned to pneumonia, how fast the disease has progressed. The cough is dry and painful. Just because cough is dry, it is painful. You could find, just because of the suddenness, the violence, you can find a blood streaks in the cough. So never get panic when a patient comes and says that I have a blood in my cough, unless and until it is a long standing or the cough is fresh blood, you find any pleurisy or hemoptysis in the cough. Another thing, aconite is very important remedy when it comes to neuralgias, even if it is a neuralgia of a heart. If there is a hypertrophy, pericarditis, even think of aconite, even if it is a case of angina pectoris. The other system of medicine, they ask you to keep sorbitrate or disprin in your packet. You can keep aconite 1 ml. So even if you find a person with a chest pain, sudden chest pain with no cause, you can give a dose of aconite 1 ml, and you can manage well till the patient reaches to the higher center or the hospital. So there is a violent hyperemia and anxiety. If you see an angina pectoris of aconite, you will find the redness of the face. The face is red of aconite. There is suddenness. The patient was absolutely fine a couple of minutes back, but now patient is having a chest pain, is holding the chest very tightly, and has face turned red. When it comes to red, think of the remedies like aconite, belladonna. There is a symptom, white part turn red and red part turn white. You can drop in the comment section which remedies turn white from red and which turn from red to white. I'm sure that's a very easy question. And along with that, you have all common symptoms. See, I'll tell you, Materia Medica has all common symptoms of disease as well. So if you don't know the practice of medicine, I doubt whether you will be able to become a good practitioner or not. So you'll have the stitching pain in the left arm, the pulse, the fainting, the sweating. So these are all the indications of angina pectoris and indicated to aconite. If there is suddenness, the redness, the hyperemia, the violence. We can also use aconite in diarrheal conditions. Little rare, na? We always think of fever, cough and cold, but you can use aconite in case of diarrhea as well, especially during summers. We have always thought of aconite as a cold winter remedy in January, December. But during summers, if a small infant comes with the diarrheal complaints and the diarrhea is green in color, you always think of chamomilla, chopped spinach like, hot egg like. But in aconite, you'll find diarrhea with a colic. Colic is so severe, and the green stool will turn bloody. Why it is turning bloody? Because the disease, the action of the remedy, the pace of the disease is too fast. And there is an inflammatory process going on, and aconite is the remedy. When I talk about practice of medicine, aconite is the remedy of first stage of inflammation. Be it pain, be it fever, be it cough, be it pneumonia, be it distended abdomen or colic. Also think of aconite when it comes to hemorrhagic remedy. Do not jump over lachesis, phosphorus, trillium, pendulum, erigion. When it comes to hemorrhagic remedy or snake remedy or spider remedy, think of the basics. So aconite is a very great active hemorrhagic remedy when the blood is pure and profuse. So you can also use aconite in case of menorrhagia. When you think of cecal cor, sabina, thalassemia, think of aconite as well. When there is epistaxis, where there is hematemesis, where there is hematuria, but always never ever forget the mental symptoms and the suddenness. Even I have used aconite in cases of threatened abortion. My mother is in state of fear of losing child. I'll have miscarriage, I'm having a lot of pain, I'll die, my kid will die. And she's panicking all around. Think of aconite. I have to read such cases with aconite, and it worked wonder. Even in cases of labor pains, the labor pains are very violent, but the baby is not coming, not descending, not progressing. The labor is not progressing. The pains are so much, but the contractions are insufficient. Patient will be red, Patient will be thirsty, sweaty, shrieking, but there is no progress of labor. Another thing I would like to say, when it comes to fever in Aconite, this is very important. And we have a lot of fever cases these days. Aconite fever, as we know, it is sudden and it is too high, up to 104 and 105. Patient's face is red. Patient will ask for water, and apart from all that, patient will cover himself during fever. He wants to be covered even in sweat stage. Another remedy is nux vomica. Nux vomica during fever wants to cover till head, cover himself till head. So Aconite is an excellent remedy when it comes to fever, but never ever give if you won't find redness and suddenness. Patient will have a lot of restlessness mentally and physically both. For mentally we have, just mentally we have arsenic, and just for physically restlessness we have Rustox. So you have a dry skin of Aconite while having fever, lot of thirst, chilliness. When you have a pain with chilliness, think of Aconite. Tell me a remedy where you have pain with numbness. We have 3 remedies for pain and numbness. Drop in the comment section. And pain, patient should lie down in the pain. There is a lot of anxiety and cheeks are red. So there we are. I hope you have enjoyed this little sudden YouTube session. If you liked it, drop me in the comment section. Every morning I can come for like 5-10 minutes and we can share something good about any drug. And this can be saved here as well, so you can watch it as many times as well, because I believe in just studying a drug. It is better if we study it in a comparative way, so you can prepare 2-3 medicines together. So I'm new to this. Thank you so much for all the little people, little close people, those who are here. So we'll be try to back very soon with another drug and comparative Materia Medica. Till then, stay fit, stay healthy. Okay.